with achondroplasia, the legs are shorter, which also causes them to bow out. And so my legs were severely bowed, and I knew that, I was going to need need to do something at some point, because I was walking on the outside of my shoes or the outside of my feet, and, my knees were bothering me. And it was just, at 16, I felt like I had the body of, I would say, a 60-year-old. I'm just thinking of like my dad, comparing myself to him. Um, but no 16-year-old wants that, really. And so I decided when I was 16 to undergo a series of operations known as limb lengthening, and it's exactly how it sounds. I lengthened my limbs, I lengthened my arms and my legs. But um, what was the main benefit of that, my first procedure, which was lengthening my legs, was I also corrected the bowing of my legs, which that was our main goal and our main, concern at first. But I decided, because I was 3 feet 10 and I was 16, so I was done growing, and, I wasn't growing anymore. And I just decided, like, it just occurred to me one day that, I don't want to be this height in my adulthood. Like, I struggle with everyday things. And, at the time, I didn't necessarily think I was struggling, because I was just so used to how I did things. I always just adapted myself to figure, how to do everyday things. And I was just kind of like, even though that was my norm, I was sort of tired of always having to, like, figure out how to do something. I had trouble going to public restrooms. I had trouble shopping. I had, just like everyday things that we take for granted. And so I decided to go through limb lengthening, and I went through 2 leg lengthening procedures. And so today I am 4 feet 11 inches tall, which is definitely a world of a difference. And it's the procedure is something that's not necessarily, or it's not at all really, I would say, accepted by the dwarfism community. It's a very kind of, um, what's the word I'm looking for? Not sensitive, but, it's just a very unpopular, I guess, procedure that people don't really approve of, which I understand. But, anyone who goes through it is going through it for the benefit, for their health benefits, and for just wanting a better life for themselves. They're not doing it to, what a lot of people confuse with, they're not doing it to really fit into society's standards, or, the average body image that people, think about. That's really not, why people go through it. I mean, I will say I do, there is a part of me, and I have said before, I also did it because I did want to be normal, but I wanted to be that for myself. I never felt pressured from society that I needed to go through that, um, go through that procedure. And, when I say the word normal, I say it because I wanted my body to be proportionate. That is true. But, I wanted to be what I considered normal, not what, what everyone thinks that society deems normal. And so it was just the best decision that I'd ever made. And it turned into this whole, patient advocacy thing that I'm doing now, which I honestly never thought I would, like, I never even really knew patient advocacy was a thing when I was 16. And so, but now that I am doing it today, it's just, it's the most rewarding experience that I've been able to go through. And so that's why today I'm an advocate for, everyone with achondroplasia and other forms of dwarfism to have, options, because there are treatment options becoming available for individuals with achondroplasia that's besides just limb lengthening. Currently, limb lengthening is technically the only treatment option available that, benefits those with achondroplasia, given all the procedures that someone with achondroplasia have to go through, like spinal fusions, decompressions. I mean, those are, I would consider, treatment options as well, but treatment options like limb lengthening and pretty soon therapeutic treatment options, those are all treatment options that hopefully prevent the treatment options that individuals with achondroplasia go through because a complication has occurred from having achondroplasia. And so I'm just a very big advocate for, letting people know what their options are and what options are available, and that, pretty soon the option that I decided to go through isn't going to be the only option available. And so that's why I'm very, proactive in trying to get the message out there about the different options available.